Thank you and welcome to the show. The topic this morning is nursing care at Meharry's Hubbard Hospital, and we're fortunate to have with us as our guest this morning Miss Anita Booth, who is the Director of Nursing at Meharry's Hubbard Hospital. And let me welcome you to the show this morning, Miss Booth.
Thank you.
Ms. Booth, what we'd like to try to do this morning is to talk about Hubbard Hospital and General Hospital have talked about coming together or merging, and that there's been a problem in terms of the occurs. What are your conceptions or your ideas, or how do you perceive patient care among the merged institutions if that were to happen?
Well, I'd like to call it a consolidation of services and not merger, because in Nashville, as you know, Nashville's a great city. Meharry has been known throughout the United States and the world. And I feel bringing the services together as a hospital, as one, will certainly enhance the patient care in Nashville, Davidson County, and even in the country. This will also enable us to bring in more physicians, more nurses, and provide the quality care for everybody, not only the poor and underserved, but for everybody.
Very good. Being the Director of Nursing at Meharry, why don't you give us some information about some of the successes and some of the challenges that you've met in terms of being the director at that institution?
Well, as you know, I've been interim director since April, and as interim director, I became director recently. And due to my background before as a director of nursing for 3 years at a local hospital, I feel I came with Meharry with an upbeat to give them more positive approaches. I really believe in good patient care. That's something that I've always stood for. I've been a nurse for 27 years. Certainly this, some of my background has certainly helped. Prior to the time that I got to Meharry, I grew up in Nashville. So I know the struggles Meharry's gone through, not only that, but also people in the country. I went to Pearl High School. I admired Meharry. I've always admired Meharry because as a kid, I knew the nurses there. My mother worked at Meharry. So that's where I really saw the image of a nurse at a very early age. The other thing, I finished Pearl High School, looked for a nursing school. When I graduated in '60, could not find one in Tennessee at that time that would take a minority, and I went to Grady in Atlanta. I went there, graduated, and came back to Nashville, worked here in Nashville, went on to get my degree. I have a master's in public administration from Tennessee State. I'm also a nurse practitioner. At the time in the '70s, Meharry had a program for nurse practitioners. So I really feel very proud, very good to be a member of Meharry's staff.
And so you've been involved as a career in nursing, not only in Nashville, but you've also been involved in other areas. And
yes.
You feel that that kind of service will help or perhaps enhance what you're able to do in Meharry?
Yes, I've also received further education at the University of Virginia in epidemiology, CDC in Atlanta. So I do have that background along with the healthcare administration and management that I've been concerned about. By and large, I've always worked those 27 years as a nurse. I also am concerned about the elderly, and I have worked in that area also.
Very good. But one of the things that we've all been concerned about has been the number of people that are involved in the nursing profession now. I'm sure that Meharry, like other hospitals, do have problems in terms of trying to attract nurses. What are some of the problems and some of the successes that you can talk about in terms of trying to attract the adequate number of nurses to do the kind of job that has to be done at Meharry now?
Well, nursing by and large, as you know, is a very competitive field. And hospitals certainly attract nurses, not only based on the monetary value, but nurses at Meharry, I feel, are very dedicated. We are basically close to being where the other hospitals are as far as pay. But it is not only the money. It requires a dedicated, caring person to be a nurse. The hours are long, the stresses are there, but however, it takes patience and endurance. And I find that one of the things that we've done is try to provide for our nurses that want to go on to further education at least some stipends or some money to provide for going to school to further their education, giving them the opportunities to go. The other thing I feel we have at Meharry is we have a grand rounds program, whereas our nurses are thoroughly involved in providing grand rounds on different subjects. One of the basic opportunities.
What do you mean by grand rounds? I don't think
okay.
that many of our people understand exactly what it's meant.
I think they understand. They've seen TV a lot to see physicians have grand rounds where they talk about a specific disease, a specific topic. We are having the opportunity to have our own grand rounds. Not only at Meharry do we have nursing grand rounds, but we're able to interact with the physicians to learn on their level. That's very important to enhance our credentials, to enhance our knowledge as nurses.
Very good. Recently, there was a national convention held here in Nashville, and I think one of the things that came out was the national shortage of nurses. As a matter of fact, I think on several occasions we've done shows dealing with the shortage. Why don't you talk about that shortage and perhaps give us some information relative to what Meharry is trying to do in terms of recruitment to deal with that as a problem.
All right. Well, there will always be a shortage of nurses. We know that from the statistics. As you know, a lot of the 3-year schools are no longer in existence. The 2-year schools are small in number. Meharry has, right now we're working with Tennessee State. We do have their students. And we try to recruit from the local hospitals that do have, and the local schools that do have the 2-year programs or the nursing programs. It will always be there. And I feel we have to maintain something to attract nurses, and that's being competitive, providing quality care, providing some areas that are unique and different in the hospital.
Now, you mentioned the fact that the nursing shortage will always be. Now, is that because we're not producing enough nurses, or do you think that the opportunities for people to become involved in nursing are such that people do not want to become? I mean, why should we assume that there should always be a shortage in nursing?
Well,
is there some